Happy New Year, everybody. I'm kind of pausing here to make sure everybody is getting connected to their audio. But I'm Dr. Kenesha Bryant-Moore. I'm the director of the Faith Network here at the University of Arkansas for Medical Sciences in the College of Public Health. And I'm like super excited for our first Lunch and Learn for the year for 2023. And we actually have today Dr. Nick Zoller, who just happens to be my neighbor here within our department. So we're in the same suite and his office is right next to mine. So hopefully I'm going to stay mute so you don't hear any echoing because our walls are a little thin. But today, Nick is going to talk about the role of the faith community in addressing mass incarceration to improve public health. Nick has been here in the College of Public Health for, I know you can correct me if I'm wrong, it's been almost 10 years, hasn't it? About a decade. And he's also the director of our Southern Public Health Criminal Justice Research Center here in the college. So I am going to go on mute so he can start his presentation. But as he's talking, please feel free to put any questions you have in the chat. Just in case, so you don't forget them. And then at the end, we will have time for some Q&A. And this is being recorded. So I always tell people that, so you know, don't say or do anything you don't want on the front page of the paper. Or I should say from social media these days. But just to let everyone know that it is being recorded. And so if you want to access it at a later time, it will be available on the website. Or if it's someone that you wanted to make sure that they have this information as well, you can share the link with them at a later time. All right, so I'm going to hand it over to you, Dr. Zoller. Thanks for being here.
Okay, great. I'm going to, do I have share screen powers? Let's see, I do. Can everybody see that?
No, it's not showing up.
Oh, wait a minute. Let's see. Can people see now? Is that showing up or no? Yes?
Yes.
Yes.
Okay. Is this in slideshow mode, or is it, can you see the presenter thing? What does it look like? Because I can't tell. If it looks okay, I'll just keep going.
You're in presentation mode.
Right.
So I don't need to fix anything. Okay. Okay, great. So I'm just gonna talk a little bit about my focus on incarceration and criminal justice involvement, and sort of talk a little bit about some background how this has a public health impact, and talk a little bit about how this plays out in our state of Arkansas, and then a little bit about some of the work that I think all of us can come together around to try to improve some of what we've been seeing over a period of really decades. So I want to start with a little bit of historical perspective, mostly because we're sort of seeing a boomerang effect in many ways in terms of this tough on crime approach, and a lot of discussion both locally and nationally about fear around increases in crime. And so I want to take us back a little bit to the 1994 crime bill, which has gotten a lot of attention in terms of the overall emphasis around sentencing practices, especially for drug related crimes and drug felonies. And this was sort of an extension of the 1986 bill that really established things like mandatory minimum sentencing practices, and also was responsible for the real significant disparities between crack and powder cocaine, which Congress has attempted to address over multiple iterations and has not really done so to this point. The 1994 crime bill, again, message of getting tough on drugs, tough on crime. We hear very similar rhetoric currently, actually. This wasn't the driving force of the expansion of prisons. There was already expansion across the country, as I said, through the 1986 legislation. But here are some of the actual consequences that we've seen as a result of this law and others that are similar like it at the state level. So it provided a lot more money to incentivize expansion of prisons in particular. A lot of additional offenses were placed in the sort of category of for death penalty cases, and mandatory life sentencing practices, and also new penalties for justice-involved youth. And the overwhelming result is this has led to just incredible racial disparities in terms of not only who's getting incarcerated, but who is having the experience of having the most severe sentences and penalties for different charges. And so just want to kind of say, take a step back and say, well, what has been the impact over this period of time, but between the 90s and 2000s up till now, in terms of how we're tracking crime and incarceration? We hear almost on a daily basis, crime is out of control, crime is rampant, we have to incarcerate more people, we need to be more tough on crime. And that's just a narrative that's not really true from a larger perspective. So if you look here at these, I want to put these two figures, this is from a very recent Brookings report. So I want to put these two figures by each other so you can sort of see tracking over a period of several decades. And this is really specific to violent crime, because this is the type of crime that understandably so most people are very concerned about. And you see that we have much lower overall rates of violent crime than we did in the 70s and 80s. So there's been not as sharp of a decrease in recent years. And we did have an uptick in violent crime in 2020. And that's still not clear what the driving forces behind that were. But then you sort of look at our incarceration trends over time. So we've had a little bit of a reduction overall, but Arkansas, we are one of the outliers. We have not reduced our incarceration. In fact, we've increased it. We're one of the handful of states that have gone in the opposite trend. But if incarceration really was well correlated with reduction in crime, we would not see patterns like this. If we could incarcerate our way out of crime, and if we could incarcerate all the so-called bad people in society, we would not see figures like this. We've increasingly increased our rates of incarceration, while we've also seen a decline over time in crime and violent crime. So it is not the case that we're not incarcerating enough people. It is not the case that incarceration is leading to safer communities. All of the data that we have just don't support those claims, even though on a daily basis, that's what we hear. So just wanted to kind of put that in for context. And so you see the state of Arkansas, we're off the charts in terms of our rates of incarceration. So again, in Arkansas, we hear a lot about, we've got crime as a problem. We need to build a new prison and we need to expand our prison capacity. Well, we're already not only an outlier in the United States, we're outlier in the entire world. So the state of Arkansas incarcerates more people per capita than any other nation, not just state in the United States, where I'm talking about nation on earth. So the United States has about 5% of the global population, but incarcerates about a quarter of the world's prison population. So we have not been able to incarcerate our way to a safer and healthier society. And I want to also make the point that it's not just individuals who are incarcerated, but if you kind of see, over 10 million arrests each year, that translates into tens of thousands on a daily basis. One thing that I wanted to make a point of is we hear a lot also about this, this is an urban problem, it's big cities. But we've seen a dramatic increase in the number of individuals in rural areas that are winding up in county jails. So in fact, now we have jail admission rates are now exceeding the arrest rates in our rural and mid-sized counties. So this is not just an urban problem, and this is just for context, a figure that just really is kind of mind-boggling. You could actually have buses all the way from California all the way across the country completely filled in a straight line, and that represents how many people we actually lock up. So it's a fairly staggering number. And as I mentioned, before COVID, the United States, we had nearly a quarter of the global incarcerated population. The key thing to remember also about this is about 95% of people incarcerated are eventually released. So, this is a significant challenge for entire communities. So it's not that we're, taking people, removing them from society and locking them away forever. In some cases, we are doing that, but most people are going to re-enter society. And that's why it's so essential for us to think about, okay, what are the tools that they're going to need to actually reintegrate? And the fact that we have expanded our use of community supervision astronomically, and Arkansas is no exception to that. So we're monitoring people in close supervision once they're released. And part of that, we under the guise of safety, to making sure that people are not doing things they're not supposed to do, really it gives law enforcement more opportunity to arrest and reincarcerate people because there's a whole litany of things that people are allowed and not allowed to do when they're probation parole. And so all of this is translated into this huge number of people who are impacted. So I mentioned that we've got this whole bus line across the country of people. Those are just individuals who we've locked up. But if you think about how many people in the United States know someone or have a family member, it's really quite a number of people. So we have over 77 million people who have some sort of criminal record. And 113 million adults have an immediate family who has ever been to prison or jail. That is an incredible number when our current U.S. population is over 300 million, but that includes children as well. So it's a good proportion of adults in the United States have directly been impacted through their family situation. So I just bring that up to mean it's not just individuals who are incarcerated, it's families, it's communities, it's all of our society really, and it's impacted. And the other thing that I mentioned before, this has our use of incarceration has not been just. We call the system criminal justice, but really it's criminal injustice in a lot of ways, because we have incarcerated Black individuals at much higher rates than anyone else. And so these rates there's no rational way to explain our rates of incarceration when you look at racial and ethnic disparities. It is the case that we have communities of color that are policed more often and over-policed in many cases, and you have a lot more interaction with law enforcement, a lot more arrests, a lot more incarcerations, a lot lengthier sentences, even if individuals commit the same crimes. So the disparities are stark, and they go across the entire system. So, who are the folks that we're incarcerating? It's still the case that we're locking up a whole lot of folks for nonviolent offenses that are related to poverty. So that's one of the driving forces of incarceration, is desperation related to poverty. And a big part of the challenge, and there's been a lot of discussion, in recent times about bail reform, and likely because this idea, the median bail for felonies is $10,000. And this is just for people to get out of a jail setting. These are individuals who have not yet been convicted of a crime. They're being held awaiting trial. And a lot of times, these county jails are holding people simply because the individuals cannot afford bail and they can't get out. So this brings up a whole issue of economic disparity in addition. And given the legislation I talked to you about a minute ago in 1986, 1994, and then subsequent pieces of legislation, both federally and also at the state level, we've seen an astronomical increase in the number of people incarcerated for drug-related crimes. So we've heard a lot of rhetoric about the importance of providing treatment for substance use disorder. But the reality is we're not really doing as much as we're saying we're doing. And particularly among people of color, that a lot of folks will recall that the response between the crack epidemic in the 80s and the opioid epidemic in the 2000s has been very, very different in terms of our emphasis on treatment versus incarceration and punishment. The other part of that is, even, like I said, even though we've been emphasizing treatment, we have not been providing sufficient treatment. And most individuals who are using drugs wind up in a correctional environment eventually. So it's not surprising that about 2/3 of people who are incarcerated have some current or past issues with substance use disorders. About half have some sort of mental health condition. In addition, infectious diseases like HIV and hepatitis, tuberculosis are highly prevalent, but not just infectious diseases, other chronic conditions as well. So the population of individuals who are incarcerated both in prisons and jails, the burden of both infectious and chronic diseases are much higher in these populations than in the general population. So you have individuals oftentimes who are incarcerated simply because they have an illness and they either cannot get access to treatment because of health insurance or lack of access because of where they live, rural versus urban environments, and inadequate availability of treatment, all of these things. And there is some access to healthcare, but it's not, it's very, very limited. So part of the challenge is you have a concentration of individuals who have significant health needs, and most of those health needs are not being adequately met by correctional facilities. So if you think of substance use disorders, for example, a lot of correctional facilities offer very limited, if any, substance use treatment, and most of the treatment that is offered is not really treatment. It's not evidence-based. It could be groups, it could be sort of psychoeducation, but it's not really evidence-based treatment. So people are not actually getting the support, the care that they actually need. The other thing to keep in mind is that incarceration itself is a severe form of trauma. So you're just being incarcerated actually has a deleterious effect on your life and your life expectancy. And I think that's one of the issues that is challenging, even when we say, okay, somebody's been incarcerated for years, then they're released and we say, okay, great, good luck. And there is very limited linkage to all sorts of services they need. But we expect people to get a job, get stable housing, all of these things without really consideration of the serious health consequences that they've experienced prior to and during incarceration. And one point to really pay attention to is the overuse of solitary confinement. Arkansas uses solitary confinement almost more than any other state in the nation. People that have pre-existing behavioral health conditions, you might imagine that being locked in a cell for nearly 24 hours a day with no human contact is going to make any mental health condition that much worse. And then people are being released directly from a solitary confinement situation to the community without the resources and the tools they need to maximize their chances for success. So again, this all sort of leads to a really difficult and sometimes insurmountable challenge for a lot of folks who are coming back into our communities. The other thing that is increasingly common in a lot, especially in a lot of our prison settings, is the number of individuals who are older. And this, again, is because of very harsh sentencing. And we are seeing a resurgence in the rhetoric around people need to serve the full term of their sentence. We have overwhelming evidence that once people reach a certain age, their chance of committing a new crime is almost zero. That doesn't seem to matter to policymakers because what matters is punishment. People need to be punished to the fullest extent that we can. The other part is that this makes things very complicated within prison settings because now you have an aging prison population that needs a lot of specialized healthcare that the prison environment is not conducive. Prisons are very structured entities, and individuals who have any kind of cognitive impairment or early onset dementia are in a very difficult position and often at high risk for harm from their fellow individual peers and also from correctional officers. And now we have a situation where the proportion of individuals over 55 has actually exceeded the proportion of individuals under 25 in our prison system. So we now have seen this inflection point where we're starting to see, because of our lengthy sentencing practices, and a serious issue with aging in our prisons and the complex healthcare challenges that creates. So a big part of the surge and how we're going to reverse this, I think it is really around the narrative. And this is something that, on the one hand, it's, we are often swept up in sort of rhetoric and discussion about that really centers around fear of crime, fear and the response, punishment. So a primary driver of mass incarceration is really our cultural, and I say this very broadly, fixation on punishment at all costs. And I think it's important to distinguish between punishment and accountability. So I think it's not the situation that people should not be held accountable for things that they do. It's more of what is the level of punishment that we as a society feel is acceptable. So we've used incarceration as a sort of very blunt instrument to hammer over large groups of people, to lock them away and really not provide them with the behavioral health and other health care needs they need, and then release them back into society without the tools, skills, and healthcare access that they need to really be able to survive in the communities they're being released back to. And we assume that public safety depends on this. We assume that, well, gee, it's a simple thing. We've got people committing crimes. We need to lock them up, and we need to increase our use of incarceration. We've heard politicians, from here and elsewhere say that we have an under-incarceration problem, that we're not incarcerating and locking up enough people. But as I mentioned before, if it was a case of locking up enough people, we'd have the safest society on earth, the way we use incarceration. But clearly that's not the case, so something is not working. This message of using incarceration as a way to make our community safer is not based on evidence or science whatsoever. It's based on sort of this internal appeal to people's fear and their desire for punishment. And I would say that for specific to this audience, and I think we talk about the role of faith community, I like to sort of frame incarceration really as a moral imperative. So Michelle Alexander, who wrote a really compelling and extraordinarily well-researched book called The New Jim Crow, really talking about our drug laws and how that has really fueled mass incarceration. She had a really telling quote that this is not simply a legal problem or a political problem. or a policy problem. It raises profound moral and spiritual questions about who we are individually and collectively, who we aim to become, and what we are willing to do now. So I think, to me, that's an important quote that resonates, saying, this is not just about, it's not as simple as good and bad, right and wrong. I mean, I think that that really this raises profound questions about how we treat individuals in our society. What is the climate that gives rise to some of the crime that we're most afraid about, and so how do we really address some of these structural factors? And so increasingly in different parts of the country, there are starting to come together national networks of faith communities that are engaging in a tactic known as faith-based community organizing. So that's one way that different places in different parts of the country have come together and say, hey, this is not working. How do we do better? How do we think about our own values and this idea, this moral imperative, to really think about issues of social justice and racial justice and equity and all these other concepts that we hear about? How do we put that into practice and really try to use that framework to address incarceration? And so one example that I just wanted to mention, and so I know some of the folks part of this group, they're based in Minnesota, they're called Isaiah. And so it's a network of faith-based organizations. And one of their primary goals is to really try to address mass incarceration. They've done things on a regional level. They've been very active in Minnesota. And just as some examples, some of the things that they've really tried to identify in their areas, looking at cash bail for low-level offenses. I mentioned before, that's one of the reasons why people are held in jail, is they can't afford to make bail, and so they're just held until their trial. Increased transparency in sentencing practices. So we've seen a lot of states and in the federal system moving away from mandatory minimums, giving more discretion to judges and understanding, does the punishment fit the crime? And so I think that's really what the transparency and sentencing practices means. Increased use of diversion programs. So a lot of that is on the front end. It could be at the level of interaction with law enforcement. There's a model nationally called the Law Enforcement Assisted Diversion Initiative. So it started in Seattle, and there are a number of sites across the country. And that's when law enforcement comes into contact with an individual who has a substance use disorder. Instead of arresting them and taking them to jail, they connect them to treatment in the community. And then, one of the things that they've been doing increasingly recently is looking at legal defense for people who have been detained for immigration situations. So, one of the things, how to sort of make this more relevant on a local level. So I think, important to really rethink this idea of, tough on crime. What does that mean? What does that mean to us, not as an individual level, but on a societal level? And so I think one of the key aspects here is we have a very strong and diverse faith community in the state of Arkansas, with a lot of influence on our policymakers. So thinking about, how are we addressing crime? Is it just expanding our prisons and that's really what it's all about? Or do we want to think about, well, what are the driving factors of crime? What are some of these structural determinants? And some of that thinking leads to more of a use of a restorative justice approach, which a number of communities across the country have been engaged in, which really looks at how do you engage communities around what works best for them? What would they like to see in addressing crime in their neighborhoods? So more of a sort of community-focused, community-based approach for addressing some of the most important drivers of crime within specific neighborhoods and communities in cities, and also in rural areas as well. Looking at the policies that we do have on the books. Are they just? Are they equitable? A prime example that people use is going back to the crack cocaine disparity. How can you have at one time 100-to-1 disparity in terms of sentencing between crack and cocaine, the substance itself is identical, chemically identical. It's like water and ice, same thing, different formulation. Ice is water. Water can become ice, same thing. But yet we punish possession of crack and cocaine historically at enormously different levels. There is absolutely no justification for it whatsoever. And so some of the rhetoric is around, well, we need to lock up the dealers and the traffickers. The vast majority of people that are arrested and incarcerated for crack are not traffickers. They're not kingpins. They're not people that are high up in the food chain. They're the lower level individuals. And those are the people that wind up in the system. The traffickers historically have not been trafficking crack cocaine. They've been trafficking powder cocaine. A lot of the cartels, that's really what they dealt in, particularly in the 70s and 80s. So this idea that we need to go after the cartels who, because of crack, it's just a fabricated story. And then really thinking about more resources in our communities. So, we have, from a policy perspective, there is always a debate on, the role of investment in communities and where those investments should come from. But, to be honest, if we want to get out of some of address some of the challenges, it's going to take investment. That means it's going to take funding. We're going to have to spend surpluses that we accumulated, or we're going to have to choose a different way to invest invest our resources in communities. And I think in partnership with communities, as opposed to say, well, we're just going to have a blanket policy just because that's what we want to do to save money. I understand that, but at the same time, we're going to have to actually dedicate resources if we want to really address some of the key challenges. And it starts with, childhood all the way up. You can't have a state that has the levels of child poverty, child food insecurity. We're the highest state in the nation in terms of the average number of adverse childhood experiences our children have. We can't have a climate in our state that allows children to grow up like that, in poverty, in food insecurity, and their parents not being able to provide for them. We can't have an environment like that and expect to improve crime. That's just the two go hand in hand. So I think really just thinking about how do we really get away from this narrative of fear. Fear leads to punishment. Punishment is incarceration, as opposed to, if we really are serious about crime, the same factors have been at play decades and decades and decades. But we haven't taken a different approach. Overall, as a society, we've relied more and more on incarceration. So just to kind of summarize, because I didn't want to take up too much time, wanted to have some discussion with folks, but I think an important thing, in my mind at least, everything is really connected. I think it's important to balance individual risk and versus the needs and risks versus community needs and risks. So I think it's easy to get sort of caught up in sort of individual level behavior. At the same time, thinking about what are sort of larger areas of focus and resource allocation that benefit not just individuals but entire communities, neighborhoods, communities, cities, towns. And I think shifting our thinking in terms of what do we mean by punishment and how do we hold people accountable, and at the same time not lock people up for 30-40 years and then they come back and they're not able really to reintegrate successfully into society. And a key part of this is if we're also serious about the idea of rehabilitation, which a lot of correctional institutions talk about, then we have to use evidence-based practices to actually provide services to people. And that's both within the carceral setting and post-release. So as I mentioned before, this is particularly the case with substance use treatment, in that most correctional facilities do not provide evidence-based treatment. And most facilities in the state of Arkansas do not provide evidence-based treatment. For example, we've heard a lot of discussion about opioid use disorder, and we have really effective medications to treat opioid use disorder, but none of our prisons will allow that. And most of our jails also will not allow that. So this is an evidence-based treatment to provide a healthcare service that has been shown to be life-saving for people and prevent overdose and help people to reintegrate back into society, but we systematically deny people access. And there's no rational reason for it. It's just people say, well, I don't like it, or I don't agree with it. There's nothing to like agree or disagree. I may agree or disagree with someone's, I'm not someone's dietary habits, but I'm not going to withhold insulin from them if they have type 2 diabetes. But yet we do the same thing. We legally discriminate against people with substance use disorder and mental health issues. So that's something that's got to change. And looking at positive reinforcement, not just incarcerating people, but really encouraging better access to treatment, giving people opportunities to do the right thing. If someone it has an opportunity and they have the resources they need, then the chances are they may surprise us and do what they need to do and have the supports and resources they need to do it. And then I think this idea of equity is important to think about, because there are some individuals in some populations that do need more resources than others. It's not about equal allocation of resources, because that's not always the fair and most appropriate thing to do. There's some populations, some individuals, particularly people with behavioral health conditions, that are going to need more resources than others. They have unique challenges with respect to treatment, with respect to reintegration of society. And so I think this is the notion that we really have to have more targeted resource allocation to figure out who are the folks that really need the most support, and how do we direct resources to those individuals. So this is our Center for Public Health and or Center for Criminal Justice and Public Health Research, in case folks are interested. And that is the end of my presentation. So I can, how do I stop sharing here? Oh yeah, stop share, hit the button. Okay.
All right, great. So I don't know if you can see, you have some questions and comments already in the chat. I'll read the first one from Reverend Nettles. So he says, from a faith perspective, the love of money is the root of all evil. Has your research shown a correlation of race, economically driven motivation? I don't know if you've done research in that area, but have you seen a correlation between the race and then people being economically driven?
I mean, I think that, we certainly, have to think about the racial wealth gap. I think in the United States, I mean, that's one important consideration. I think that it really just, it depends. I think that people who don't have economic opportunity are going to do whatever it is they need to do to get by and to survive. I would say that there of course is to a lot of different kinds of crime. There may be an economic driver, but some of it and a lot of it actually, especially for individuals who have limited economic opportunity, a lot of it relates to survival. And really trying to, especially for people who have a substance use disorder, they're not necessarily, that part of the drive for them committing crimes may be economic, but that really relates to how am I going to be able to support myself in using drugs, because I'm going to go into severe withdrawal if I don't. And so all I'm focused on is how do I get enough money to buy more drugs to maintain my addiction. So, I think that a lot of these things are of course, intertwined.
All right, so we also have some comments and questions from Dr. April Shepard. So she says, I was thinking the same thing, Reverend Nettles. I believe that prisoners are the only population allowed to basically be slaves working for free. Many rich people invest in prisons. Our new governor has a mandate to increase prisons and funding. Dr. Zeiler, have you presented this information to lawmakers?
So I have a lot to say about that, but since this is being recorded, I probably shouldn't. You know, I kind of, yeah, I mean, the mandate, we don't, I would argue we don't have a mandate to build a new prison. That's just the idea that let's just do that. And it is true that the Constitution does allow for slavery as a form of punishment. And multiple states actually, this last election, Missouri, it failed in Missouri, but multiple states have actually tried to outlaw slavery altogether, even among individuals who are incarcerated. So, you know, again, I'm hopeful that, you know, with, you know, a new administration, there will be some, you know, rethinking. I'm concerned that, you know, again, we're already hearing the rhetoric of, you know, kind of, we need to build a new prison, we need to expand our prison capacity. So it seems like that's kind of the direction that we're moving into. But, you know, that's, we're just going to see more of the same, I think.
All right, and Dr. Shepherd actually shared another question about changing laws for people who have mental health illnesses or mental illnesses. And I would, since this is the faith network, from a faith perspective, because sometimes I think some faith leaders feel like, oh, maybe I shouldn't get involved in certain things, though historically, particularly within the Black church, I mean, changing societal things that we saw that was wrong was a part of like this, the history within it. So from a faith community's perspective, how can we get involved to actually make these policy changes and talk to lawmakers to have a greater impact when it comes to supporting people who have mental illness?
I mean, I think that, you know, one is, you know, we need to have more resources to provide better treatment. I mean, that's a key part. So, you know, I think we're doing better. And I think it's a little bit, right now, we've seen a little bit more of a shift around mental health than we have around substance use disorder. I mean, I think the problem with drug use, it's you know, the only illness for which it's illegal to be sick. You know, you're using drugs, you're breaking the law. So it's a lot more difficult sometimes for people to have those discussions. But I think more and more, this is becoming a nonpartisan issue, that people that have severe and persistent mental illness, if we don't have effective treatment options for them in the community, then, you know, people tend to spiral and do very poorly. And we have made some investments recently in this. You know, we have crisis stabilization units in Arkansas. You know, we have several of them, including one in Pulaski County. And that's an important piece of the continuum. So if an individual is in crisis and they come into contact with law enforcement, then, you know, probably the most appropriate place for them, especially if, you know, they haven't committed a violent crime, is not a jail cell. You know, they need to actually engage with a mental health professional. And so that is part of the continuum. And I think just across the board, just having more mental health resources, and the fact that a mental health crisis, why is it that we as a society feel like that needs to be responded to by law enforcement? So I know the emphasis around has been, we need to train law enforcement to be better equipped to manage people with behavioral health conditions in the community. And I absolutely agree 100%, and I support that. And at the same time, not every 911 call for distress needs a police officer to arrive at the scene. You know, I think it's, you know, I think that we need to really rethink, and there are localities that are rethinking, okay, certain calls, can those be triaged to mental health professionals, behavioral health professionals, rather than law enforcement, where there is that risk for escalation and arrest. And so I think it's not an either or, it's an and both, that law enforcement, we need to continue to do the training and help educate. But at the same time, we also need to have alternatives to law enforcement arriving. And the same thing in our courts. We need to have better education for judges and prosecutors to understand the nature of mental illness. And there have to be options for them to, I think a lot of judges can be frustrated if they sense that, well, I'd like to have an option, but I don't know where to send this person, or I don't feel that my community has the resources that are needed. So I feel like my hands are tied. I've had a lot of judges tell me that, or they've said, I feel like I'm spinning my wheels. I would like to send someone to treatment, but I send someone to something and it doesn't work, or it's not evidence-based. And that's the key area to come back to. I think people don't always have a full understanding of what treatment is and what that means. And the fact that we have a lot of evidence about what works and what doesn't. And I think we have to be really thoughtful about, really providing evidence-based treatment based on all of the science that we have, just like we treat other chronic conditions. We tell people if they have diabetes or hypertension, you need to go to a medical professional. And if you need medication, that's great. That is life-saving. But we tell people a substance use disorder, just deal with it, get over it. Your willpower, this or that, all of these things. So, it's also a chronic illness like diabetes, but we don't treat it the same way. And that's part of the problem, is we need to shift our thinking and then advocate to our policymakers, hey, if we're going to worry about healthcare and making Arkansas a healthier state, this has to be part of the discussion.
Right. And I agree, a change in that mindset. And like when you call 911 and there's an emergency, and it's a medical emergency, they don't send the police, they send EMS out. So why is it that there's a psychiatric emergency, we're sending the police rather than some professionals within mental health? It makes total sense. I have Dr. Odell Johnson wrote a question as well. It says, can you share an analogy between supportive service for opioid use versus crack and cocaine use? Arkansas has a budget of $18 million toward opioid treatment and little for crack and cocaine use. Specifically, what immediate roles can the faith community serve to tackle this issue?
Yeah, I think substance use, I think, first of all, to underscore the fact that substance use is all substances, everything. So whether it's methamphetamine, whether it's cocaine, whether it's alcohol. So I think it's not the question. It's, well, we're going to care about this substance use disorder because it's OxyContin. And so it's not your fault. It's your doctor did this to you. And so we want to support and help you. So we can't have that's got to go to the wayside. So that does everyone a disservice. And I think that, the idea is that substance use disorder, regardless of substance, is a chronic condition that needs treatment. Now, it is challenging because we don't have the best, we don't have as good of treatments for stimulants, methamphetamine in particular, but cocaine to a lesser extent, as we do for opioids and alcohol. We don't have any medications, for example, for methamphetamine or cocaine that are as effective as we have for opioids. So in some cases, we have medications that we can use for opioids, but part of the challenge for that, we don't use them enough, because people have a stigma around some of these medications. I think, to Dr. Johnson's point about, the disparity about how we view opioids relative to crack cocaine. If someone has a substance use disorder, it shouldn't matter what the substance is. And if we're going to have an approach where we say that we want to treat substance use disorder rather than incarcerate people, then that we can't apply that just to opioids. We have to apply that across the board. And I think that's a really crucial point. And I think our policymakers need to understand that you can't treat methamphetamine use different than OxyContin use or crack use or alcohol use if somebody has an addiction. Obviously, the treatment modalities are differ considerably, but the underlying chronic condition, you can't sort of pick and choose. It's got to be a holistic approach.
Yeah, and from the faith perspective in particular, like Dr. Zawa had mentioned at the beginning of his presentation, within Arkansas, the faith community still is highly respected, and as a collective could have a great influence. So I think like some of these things that we're talking about, changing people's mindsets and actually making changes within policy, I think is that people need to come together and work collectively to make sure your voices are heard. I actually was in a session the other day, and we were talking about research versus a compelling story. And oftentimes, when speaking to lawmakers, in my experiences and just in observations, that sometimes the compelling story also will trump a research that we have like evidence to actually show, even if the research and the compelling story are complementary and support one another. And so sometimes it may be what we always say in the church, it may be somebody's testimony that's actually going to have a greater impact than the stats and research that we bring to the table. I always say, bring them both. But Dr. Zoller, I didn't know if you had any other comments about how the faith community in particular can.
Yeah, no, I think that I completely agree with everything you just said. I think that the faith leaders and the faith community in particular have a very strong voice and a lot of influence over policymakers, because a lot of our policymakers are also members of a lot of our faith communities. And so we hear a lot of discussion around that we want to do the right thing and thinking about issues of justice, for better, for worse, regardless of what your personal views are. But we have, I know it's private, blah, 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 but the 10 Commandments, right near our seat of our government in the state. And so, in my mind, are we really, to coin the phrase, practicing what we're preaching? I think that's really what it comes down to. If we're really talking about forgiveness, well, what do our policies say about that? If we're talking about redemption, well, do we have policies? Do we believe that everyone really is equal? Well, what do our policies look like around that? So I think those are the key areas where, in my opinion, I think the faith community, faith leaders, and all of us really, no matter what community we belong to, we have a role and a responsibility to hold our policymakers accountable, to say, these are our values and our principles and our morals, and we all have disagreements, but I think at the same time we have a lot more commonality than I think we give ourselves credit for. And there are things that I think all of us can agree with, in terms of not wanting our children to grow up being healthy and successful, and not growing up in an environment where we have all of these really life debilitating situations like poverty and food insecurity and adverse childhood experiences. The top 2 reasons in the state of Arkansas why people go into the foster care system are parental substance use and parental incarceration. So we talk about foster care. I'm like, okay, and I understand, we need more people that are willing to be foster parents, and this is something that I've given a lot of thought to. And at the same time, how do we prevent kids from going into that system? If we don't provide treatment for the parents so they can actually regain custody, or they can actually be the parent that they reach their potential, then how are we going to actually get control of our foster care system? It's not just a question of, well, we need more caseworkers, we need more foster parents. Yes, those things. And also, we have to eliminate the conditions that children are growing up with, where they wind up in the foster care system, where they wind up, growing up and being in situations where they're committing crimes and doing these other things. So all of this stuff is linked. It's never as cut and dry as, well, you did something bad, you need to be punished, period. There's always much more complexity. I know it's easy, especially for policymakers. It's really nice to say, oh, it's right and wrong, it's very clear. It's not always so clear. And I think our response has to be a little, a lot more thoughtful and comprehensive than just you did the crime, you got to do the time. It's not so simple.
Right. And I do apologize. We do have more questions in the chat. And we're going to try to answer one quickly. We only have 3 minutes. But the one says, I found a couple of studies comparing public versus private US prisons from cost and other perspectives. However, they are from the late 80s and early 90s. Is that an active area of academic research?
Well, I think, yeah, the privatized prison industry is, they're money making. So, and you could make the case that, a lot of prisons are there's a financial incentive, of course, to warehouse people. I think part of the problem is, we as a society, if we're going to, if this is the direction we go in, incarcerate people, then that's part of what we have to grapple with is we're paying the bill. So we are paying the cost of incarceration, whether we like it or not, whether we know it or not. And that includes healthcare. One of the things that I mentioned about the prison populations getting older, the proportion of healthcare costs in prisons is only exceeded by Medicaid, and in terms of if you looked at national expenditures on healthcare, and we're paying that. So we could say, well, it's not our problem, not our, if we, expanding the prison by 500 beds, or those are dollars that are not directed towards things that we all say we care about, like education and like our children and all these other things. Well, we're making an effort, a conscious decision to put dollars into building more prison beds, or to increase our capacity for solitary confinement, which has been shown study after study after study has a hugely bad impact on people. But I agree, it's not, I could show all the data in the world and it doesn't really matter. People just say that, the stories are compelling. It's I can show you those graphs and say, well, we're incarcerating people, but it's not doing anything to our crime. And people kind of nod their head, they get glossy eyed. But I think, having those stories, having people, respected leaders in the community, especially faith leaders that policymakers can directly relate to, that is, to me, that goes a long way. And that, coupled with the data, that's really what I think, having these partnerships between faith communities and researchers like, here at UMS, I think collectively, that's what hopefully can move the needle here.
Yes, and we're right at 1 o'clock. So Dr. Zoller, I'd like to thank you again for joining us today. I did drop my email in the chat in case anyone wants to reach out for more information about the Faith Network or to join our e-newsletter that is sent out twice a month by Crystal. And we will continue to hold these virtual Lunch and Learns monthly. It is the second Wednesday of every month. So just look out, and we look forward to seeing you in February. Thanks again.
Thanks, everyone. Have a good